In this video, we review the Abbott Amplatzer PFO Occluder, a transcatheter device used for permanent closure of a patent foramen ovale in patients with cryptogenic stroke. We'll outline the clinical problem, how the device works, key data, and appropriate use. Transcatheter PFO closure is considered in patients with cryptogenic ischemic stroke who demonstrate a right-to-left shunt on bubble study or TEE. During the procedure, clinicians advance from the femoral vein to the interatrial septum and assess the PFO tunnel, which often measures 4 to 12 millimeters in length. The implant must close the tunnel without interfering with structures like the aortic root or pulmonary veins. Standard catheters can cross the septum, but they cannot permanently seal it. In short, access tools don't provide closure. A PFO occurs when the fetal septal tissues fail to fuse, creating a potential channel between the atria. About 25% of adults have a PFO, and it is found in up to 40 to 50% of patients under 60 with cryptogenic stroke. This channel allows emboli to bypass the lungs and enter systemic circulation. Medical therapy like aspirin or anticoagulation reduces clot formation but leaves the tunnel open, which is why recurrent stroke risk remains about 1 to 2% per year in medically managed PFO-associated stroke. The mechanism is pressure-driven. During activities like coughing or Valsalva, right atrial pressure can temporarily exceed left atrial pressure, opening the tunnel and allowing emboli to cross. Medications reduce thrombosis, but don't close the opening. Standard catheters provide no sustained force to fuse the septal tissues, so the shunt remains. Closure treats the anatomical conduit, not just the clotting risk. The Amplatzer PFO Occluder is a percutaneous nitinol implant designed for permanent anatomical closure. It consists of two self-expanding discs connected by a waist aligned to the PFO tunnel with polyester fabric to promote sealing. It is delivered through a femoral venous sheath under fluoroscopic and echocardiographic guidance. Once deployed across the septum, the two discs sandwich the septal tissues and eliminate the gap. The fabric reduces residual flow and promotes endothelialization over 1 to 6 months. Doppler and bubble study confirm the absence of right-to-left shunting, removing the pathway for paradoxical emboli. The device uses nitinol mesh with embedded polyester fabric and is delivered through a 9 to 12 French sheath. It comes in multiple disc sizes, is fully repositionable until release, and is MRI conditional up to 3 Tesla. These features enable controlled placement and long-term closure without open-heart surgery, with closure success above 90%. The procedure begins with femoral venous access. A sheath is guided across the PFO using fluoroscopy and TEE or ICE. The left disc is deployed first, followed by the right disc. Position and residual shunt are assessed, then the device is released. Procedural success is defined as correct position with no or trace residual shunt. Multiple randomized trials demonstrated benefit for secondary stroke prevention. In RESPECT, the device reduced recurrent stroke by 62% relative risk versus medical therapy. In CLOSE, no strokes occurred in the closure group versus 14 in the antiplatelet group over 5 years. REDUCE showed 1.4% versus 5.4% stroke recurrence. Meta-analyses calculate absolute risk reductions around 3 to 4% and numbers needed to treat of about 25 to 30. Complications include access site issues around 1 to 2%, self-limited atrial fibrillation in about 3 to 6%, and rare device embolization or device-related thrombus. Residual shunting at 12 months occurs in under 5%. Risks are mitigated through imaging guidance, proper sizing, and short-term antiplatelet therapy during endothelialization. In summary, the Amplatzer PFO Occluder eliminates the anatomical shunt, achieves over 90% closure, reduces recurrent stroke by 60 to 70%, and maintains low major complication rates. Appropriate candidates are patients 18 to 60 with cryptogenic stroke and a bubble study confirmed PFO, consistent with the criteria used in clinical trials.